direction.
Any direction. And then I do what's called a jaw sculpting. So in jaw sculpting, shave the bone in the areas so that it contour it.
Right.
So that's why these go hand in hand, and then you get really good results. Another thing which you have to notice, which I also think subscribers should know, is the lower lip size. It reduces generally. So now in your case, your lower lip is thicker than the upper lip, right? People have come to me asking for lower lip reduction surgery.
Right.
And actually the problem is with the chin. Because the musculature goes like this and goes here. When you stretch it forwards and downwards, even the lip gets thinner, the muscles go inside. So the shape of the lower lip especially also changes. So when you look at a profile like you, don't have a very bad or very short chin, but still your lower lip is thicker than the upper, and this is no mentally fold. So when you do that, all what you desire will happen.
Yes.
Right? So anything else you want to ask me?
No.
Nothing?
Just looking
Cool.
for great results.
Yes, that is for sure. And you're going to be with us for how many days? Have you already booked your return tickets? 5 days.
I'm not. I'm
You've
planning
not.
to stay here for 2 to 3 weeks.
Really?
Yeah.
Oh, okay, you already love the place.
Yeah.
You mean the peaceful place?
Even my friends are here. They stay in Trivandrum themselves. So
Okay, cool. That's excellent. In which case, if you are even in Trivandrum, so you could be here with us for 4-5 days, and once your first recovery is over, you can head back to a location and chill and something. Come back before you eventually get back to Mumbai.
Sure.
Up to you. I mean, that is always possible. We're happy to see you a little later. So then, if any more doubts you have, that also will be taken care of.
Sure.
Alright, now the surgery per se, we're going to give general anesthesia through the nose. You shouldn't have any problem with your breathing after surgery, though that side might be a little blocked. The surgery might take an hour and a half, maybe a little bit more. When you wake up, you should not have much pain. You would have given all blocks, but some patients do complain of some pain here, throat, because of the anesthesia. But we will take care. And first few hours, we won't let you have anything to drink also.
My question is, what after doing surgery, like I'll be in a ICU for almost 24 hours, right?
Well, till tomorrow morning is fine.
We can work because many of my friends are there.
You can work tomorrow.
Tomorrow I can start working.
Absolutely.
Right? There would be no issue. Even I heard here we do have a Wi-Fi system and people can use Wi-Fi and can go.
Sure, you can work. Many of our patients do that. Especially after genioplasty, you can work. No issues at all. No problem at all. You can absolutely work. Alright, so we're going to start. See you. Super, bro. We have.
BP cuff.
A genioplasty with jaw sculpting for this gentleman who is in his 20s. So his main concern is the chin is not as projected as he would want it to be. So we're going to augment it by 12 millimeters. That's the plan, a little bit more better. Also augment it vertically. So vertical augmentation meaning this height of the chin is going to be increased. And when I say horizontal, this height is going to be increased. So the future chin is going to be something like there. So we give him a better mentally, we'll fold. His chin is pretty broad, so I'm not going to do much with that because we want it to be remaining broad for him. And I'm going to make a little longer extension so that the entire part of the chin moves forwards and down. How short and stubby the chin was. And now we're also going to show you the front view. So this you can get a good idea of the augmentation that has been done. In fact, the whole proportion of the face would change, and facial aesthetics depends a lot on proportion. So this was before we did the genioplasty with jaw sculpting, and this is him just now after we finished. So you can see the improvements, gave him a much more strong personality now. So we've just finished with the genioplasty. This was a horizontal sliding vertical augmentation genioplasty. There are multiple ways in which you could do a genioplasty. the real beauty of it is that you could get 3-dimensional results. You can get the chin, the lower third of the face to move and get the desired results. So in this case, we have actually increased this height of the chin by 7 millimeters and we've increased the projection by 14 millimeters. So by doing that, we've improved his projection, proportion, and also we've given him a much stronger chin, and this just took it as an hour. Thank you. धीरे धीरे लूज होगा, टाइट लगता है क्योंकि आपने बहुत एडवांसमेंट किया है. मसल स्ट्रेच होना है, स्किन स्ट्रेच होना है.
और जो नम लगता है
वो तो बाकी आ जाएगा आपको, वो बिकॉज ऑफ सर्जरी. नमनेस पूरा आपको वापस आ जाएगा.
ये क्योर हो जाएगा, पूरा भर जाएगा ऑटोमेटिक.
मस्त. Already you're handsome. Who told you you're not handsome? Hey, get the before picture. iPad le. So we have this guy just 3 days after we've done a major genioplasty, jaw sculpting. I was just having a conversation with him. So he has some tightness. All of that is going to be there. I've just told him for a few more weeks because of the fact that we've done huge augmentation. We're also going to show you your photo, and then if you're leaving tomorrow, we'll take your scan. If you have time, you're welcome to stay with us for a couple of more days. No issues. If you really have to go, we can send you tomorrow because 4 days is fine for you.
What about that?
Oh, they'll all go on their own. They'll disappear on their own. So you can see the result here on the side, especially, which you're going to appreciate a lot. Just for the side, please. So you can see that he's got a whole new chin. The entire lower third of the face has been augmented. उंगली कुड़ आप भी देख सकते हैं, एक बार देख लीजिए. साइड में देखो ऐसा, तो इसमें प्री ऑप भी देख लीजिए. ये देखो ना, this was like a C. You can see both in the mirror, so you can see the difference. Yeah, now it's going to have a much. This length has been increased. This height has been increased. Plus, you'll get a depression which you didn't have. You see how it was earlier? It was like one short stubby cheek with a double chin. That all will disappear.
And even I'm planning for hair transplant.
3 महीने वेट करो मिनिमम. 4 months we'll wait. हाँ लगा देंगे. That is the easy procedure इससे. Wherever you want we can put.
I want to come from इधर से पूरा निकालना.
हो जाएगा. That's not a problem. तो आप बताओ, अगर आप कल जा रहे हैं तो मैं ये आपको कल निकालूंगा. अगर आप 2-3 दिन यहाँ रहेंगे फिर जाने से पहले
मंडे को
बस
डिस्चार्ज ले लो.
अच्छा है तो दे दो. मंडे डिस्चार्ज, सो संडे विल डू इट.
व्हाट अबाउट ये जो टाइटनेस रहेगा, निकालने के बाद थोड़ा बहुत लूज होगा?
नहीं ज़्यादा नहीं होगा लूज. ये लगाया हमने आपको प्रोटेक्शन के लिए. जब एडवांसमेंट बहुत होता है यहाँ से कट हो जाता है, जहाँ से कट है वहाँ पे प्रोटेक्शन के लिए लगाया है. टाइटनेस क्यों है? टाइटनेस है बिकॉज काफ़ी ज़्यादा आपके इसमें 14 मिलीमीटर्स किया है हमने, खींचा है तो रहेगा टाइटनेस. कैसे निकलेगा? हाँ, द नमनेस विल बी देयर इतना बिकॉज ऑफ द फैक्ट दैट सप्लाइड बाय द मेंटल नर्व, बट इट विल ऑल कम बैक.
3 months, 2 months.
Well, up to 3 months, but sometimes even in few weeks you'll get it back.
Parents are not, informed about this. उनको नहीं पता इधर है करवाने के लिए.
शॉक होगा उनको देखने के बाद, अरे क्या हो गया, अब मेरे बेटा अभी मॉडल कर सकता है.
3 महीने लगाना पड़ेगा. हाँ? वो सब 3 months.
क्यों? अरे they can't find out for 3 months. वो आपको लगेगा ऐसे. Outsiders will not know. बाहर के नहीं पता चलेगा. आप जा सकते हैं 1 हफ्ते में. मंडे चले जाओ वापस, कुछ नहीं होगा. हाँ, मंडे चले.
अच्छा, जो खाना पीना रहेगा सेम मूवमेंट रहेगा ना, पेन रहेगा जैसे
थोड़ा रहेगा.
as of now.
वो तो रहेगा ना, बिकॉज सॉफ्ट टिश्यू का भी वर्क हुआ है तो थोड़ा पेन रहेगा हीलिंग टाइम पे. अभी तो फिलहाल आपका 3 दिन ही हुआ है कंप्लीट. आज 4th डे है, उसके लिए तो बहुत अच्छा है. ह्यूज
improvement. Even I can talk. Even I'm working. I've been on call
Excellent.
for 8 hours, 7 hours, so I'm working. I'm able to talk.
Very good. So you heard that he's able to work, and this is just 3 days after a major genioplasty jaw sculpting. That's a good thing. That's what I tell a lot of my patients that, I mean, some people have more swelling than you. ऐसा नहीं कि हर किसी को swelling नहीं होगा. थोड़ा बहुत ज़्यादा swelling हो जाता है कभी कोई पेशेंट्स को. आपका काफ़ी स्मूथ है, काफ़ी मतलब बहुत कम swelling है. But generally patients can or people can start working or doing their work दूसरे तीसरे दिन में. तो that is good. But tightness रहेगा आपको थोड़े और weeks. आप 2-3 महीने पकड़ के चलो, तब तक ठीक हो जाएगा. ठीक है, तो व्हाट विल डू, विल नॉट रिमूव दिस प्लास्टर नाउ, विल वेट टिल संडे, फिर आप मंडे जा रहे हो, एक दिन पहले निकालेंगे, आपका स्कैन भी हो जाएगा, तब तक मैं स्कैन में भी आपको दिखा दूंगा क्या क्या हुआ है, क्या क्या केयर लगाना, ठीक है।
जो ये बोन उन्होंने आर्गुमेंट किया हॉरिजॉन्टली, ये बढ़ जाएगा ना?
बढ़ जाएगा पूरा, टाइम लगेगा, वो तो फिर 6 मंथ में लगेगा
कि आफ्टर 2 years क्या मैं वो निकाल सकता हूँ
प्लेट्स? आफ्टर 6 months also you can remove.
Okay, तो we can do a revision, revision type of.
Not revision, we can only remove the implant and throw it.
तो फिर ये जो चिन्ह आ गया मेरे को भी फिलहाल, तो वो चिन्ह
ऐसे ही रहेगा
permanent.
No need to worry, even if you remove the plates.
That is good. That is a great.
That will be like that.
That is a great. Sure, sir.
Okay, take care. Yeah. सेट है, तो ये भी आके मुझे यही बता रहा है फ्रॉम यू, आपके वीडियो से और आपके रेस से मुझे नहीं लगा कि ये ऐसा जगह पे होगा, मतलब कि जब वो आते हैं ना तो थोड़ा सा क्या बोल सकता हूँ मैं उसको, हाँ वो फीलिंग थोड़ा हो जाता है कि अरे ये काफ़ी छोटा है और यार ये इतना छोटा जगह पे है ऐसा। So just for that, there is something a lot of people think.
Like whenever you watch YouTube videos, right? आपका videos देखते हैं ना, people should come to know कि यार genuine है, जो भी सामने
genuine तो है लेकिन
हाँ जो भी सामने हो रहा है, हाँ it is not necessary कि that should be big premises,
correct,
बहुत बड़ा hospital है ना,
हाँ that is true. Also
and what I have enjoyed here कि I am a software engineer, right? तो मेरा first day treatment हुआ, next day I started working also.
Awesome. Okay.
Working, hanging, talking, eating, I have started my daily routine after doing this procedure.
And it was a pretty big one for you.
Correct, right.
मस्त है. It's very good. आपको कैसा लग रहा है? आपको
now I can chew hard food.
हाँ.
I can swallow. I can eat anything now.
But थोड़ा धीरे जाएंगे आप, मतलब not. You have to give it some time. You can. बट आई वुड रिकमेंड सम, हाँ 4 हफ्ता तक जब वो अच्छी तरह से हील नहीं हो जाए ना, बिकॉज क्या है सम पीपल इट हील्स वेरी फास्ट लाइक आपका इस केस पे, बट यू हैव टू बी केयरफुल ताकि नथिंग अनएक्सपेक्टेड हैपन्स, दैट्स द ओनली थिंग, गो लिटिल स्लो, दैट्स ऑल आई वुड रिकमेंड। बता देखते क्या क्या मतलब एक्सरसाइजिंग थोड़ा कम करना है एंड थिंग्स लाइक दैट, या ओके। सो वी विल ट्राई एंड टेक दिस ऑफ। सो आज आपका 6 days हुआ है ना? तो काफ़ी पेशेंट्स मेरे से पूछते भी हैं कि डॉक्टर साहब ये बैंडेज क्यों लगाते हो आप, ये बहुत दिक्कत वाली बात है। नाउ वेरी गुड क्वेश्चन, बट ये बैंडेज क्या करता है ना, व्हेन वी आर मूविंग द जॉ टू अ न्यू पोजीशन और व्हेन वी डूइंग वर्क, इट गिव्स नाइस कंप्रेशन, सो देयरफॉर द स्वेलिंग इज लेस, हीलिंग इज फास्टर, हेल्प्स इन इमोबिलाइजेशन। So there were different kind of bandages. Even now people use in many other countries. Some use bandages around their head, or some can even tie their mouth shut. But there has to be some kind of immobilization, and I think this is the least bothersome for the patient. Though the issue with this particular dynoplast or the elastoplast or the crepe bandage, which has got the glue, is that it sticks on to the hair.
That is okay. That's not like.
अरे नहीं यार, some patients scream. So it is a little.
Each time, 10 minute के लिए screaming, not more than that.
10 मिनट नहीं लगता.
Imagine अगर covering the entire face, then.
हाँ नहीं.
बेकार दिखेगा. A patient cannot talk also then.
Correct. That's
also.
Do
a head movement also.
Cool.
मैं scream करूँगा.
आपके इस पे तो जल्दी आ गया अभी. Sorry. हो गया लास्ट बिट है अभी. ओके अब हाँ पूरा निकाल दिया. आप देखना चाहेंगे अभी? Absolutely, you were always looking handsome, but now you've got the chin that you wanted, है ना?
Swelling नहीं है ना अभी?
है swelling.
अच्छा.
हाँ swelling है. ये शेप और भी बढ़िया होगा ना यहाँ पे. अभी ऑलरेडी अच्छा हुआ है.
और ये इधर का भी जॉ
थोड़ा कम होगा वहाँ पे.
हाँ जिम चालू करूँगा तो
6 weeks के बाद चालू करो प्लीज़.
Not any activities, simple
एक्सरसाइज थोड़ा कम करना पड़ेगा आपको इनिशियली, बिकॉज हीलिंग टाइम है ना. 4 weeks अगर नहीं करोगे तो बेहतर है, अच्छा ही है, बिकॉज जब वैस्कुलरिटी बढ़ेगा तो कुछ होगा तो है ना, फिर कुछ होना नहीं चाहिए. हाँ राइट. तो देखिए ये ऐसे थे आपको कैसे लग रहा है, आप ही बताओ, बिकॉज यू आर अ वेरी वेल स्पोकन ब्रेव पेशेंट, आप ही बता दो फोटो देख के कैसा लग रहा है। लिप्स देखो, मैंने आपको बताया था ये लिप्स, हाँ,
लिप्स बाहर था, आपने लिप्स अंदर कर दिया। जब इनको ऑगमेंट किया ना हॉरिजॉन्टली, तो ऑटोमेटिक पार्ट अंदर चले गया।
करेक्ट।
तो आई डिड नॉट डू एनी लिप सर्जरी और समथिंग, इसीलिए सर ने कर दिया बिकॉज ऑफ एक्सपीरियंस।
और ये आपके डिफरेंट व्यूज़ हैं, और ये देखिए इस पे है आपका मेजर वहाँ ज़रा देखो प्लीज़, धीरे से देखो, एंड गेट इट क्लोजर टू हिम, क्या होल्ड दे रहा है। सो अब देख लो, आप देखो ना, तो दिस इज द ह्यूज डिफरेंस दैट यू कैन सी, एंड यू सी द चिन दिस शेप लाइक अ सी, एंड नाउ वी हैव अ मेंटोलेबियल फोल्ड, इसको मेंटोलेबियल फोल्ड बोलेंगे, एंड देन इज अ नाइस ब्रॉड चिन, एंड देन देयर इज अ नाइस it's a contour, the whole thing that has been changed. So you didn't have exactly a double chin, but because the chin was not that strong, that gave this kind of a look, so which has all been changed. So the most important change will be on the profile, front also, नहीं, not that it won't be, but more side में बहुत ही दिखेगा। आपके साइड फोटो जब निकालेंगे बाद में,
in future अलग तो और करवाएंगे।
अरे नहीं बहुत हो ऐसे बहुत पैसे है तो कोई डोनेशन कर दो, कोई पेशेंट को यूज आएगा आपको कुछ करने की जरूरत ही नहीं है। ये हो अब एक और बार, ओके, अब ये साइड देखो,
ये अच्छा प्रोजेक्शन मिला है,
मस्त प्रोजेक्शन मिला है।
यूजुअली आवर फैमिली डोंट केयर अबाउट दिस, बट हम लोग को पता है कि इट अफेक्ट अस व्हेन वी सी आवरसेल्फ इन।
नहीं, पेरेंट्स आल्सो दे नो, बट उनको समझाता कौन है? अरे 30-40 साल पहले तो ऐसे सर्जरीज थे ही नहीं। उनको कैसे मालूम कि ये सब आराम से ठीक हो जाएगा? फॉरगेट ओल्डर जनरेशन, हमारे जनरेशन के डॉक्टर्स को नहीं मालूम है। कल भी मैंने फेसबुक में, मेरे को बहुत क्वेश्चंस पूछ रहे थे कि बारे में डॉक्टर कैसा हुआ है सब, आपने कुछ मॉर्फिंग की है क्या, ये कोई सॉफ्टवेयर ट्रिक है क्या? डॉक्टर्स को मालूम नहीं है आजकल, सब डॉक्टर्स को नहीं, बिकॉज this is not common, this is not something that was being happening for so many years, so that is why. और हमारे चैनल में मेन थिंग which I of course we like to educate people also, but they get to see that इतना चेंजेस हो सकता है, और आप बता रहे हैं कि मतलब इतना भी great difficult process नहीं है, तो it is something that a lot of us can consider thinking doing.
Painless, you don't have to go with pain, anesthesia दिया, काम हो गया, then you become really pain, एक दिन से बेड पे थोड़ा बहुत इशू रहेगा, drinking covered, next day you will be normal, you will be eating, you will be drinking, you will be talking, depending on the surgery, right?
Correct.
Even if you want, you can work also, when it's a good environment, you can come, stay, have a surgery done, and work. So even I'm working में 10, मेरा 12 hours 10 hours जा रहा है काम का। Even my PM, my manager says कि how do you manage? You're in a hospital, then to be working, because environment अच्छा है. It is first of all Kerala, where we are right, or Trivandrum or Nagercoil, it's a peaceful area, man. There is no lot of shore, sharaba. It is not like metropolitan city, right? कि pressure इधर शांति है. Sit आराम से हॉस्पिटल में आया, बेडरूम में अपने वार्ड में आया, आराम से काम किया, शांति है.
Thank you so much, yeah. Because
this is the best place what I can say, and even I'm planning to come again for beer transfer.
Oh, that is easy. उसके लिए तो आपको एक दिन ही बहुत है. इतना मतलब 4-5 दिन रहने की जरूरत नहीं पड़ेगा, फटाफट रेडी कर देंगे.
For money concern, I don't think so it's that much costly.
Yeah, because we use the quality, right? We're using German titanium stuff, plates and screws, and also our instrumentation, and then it includes the package for the full 7 days. दवा है, कंसल्टेशन फी है, सब कुछ है. तो आजकल ना
मेट्रोपॉलिटन सिटी में, मुंबई में भी देखोगे ना, people charge a lot of 2,50,000 for genioplasty. Even not sure we'll get that kind of result. Here Shar is assuring you, here Shar is telling you कि I will give you maximum, max to max, मतलब तुम जैसे मांग रहे हो वैसा मिलेगा, you will get it. तो इट इज एक बर्तन में दे रहे सर.
एंड दोस्तों, मैंने इनको नहीं बताया कुछ ऐसे बताने के लिए. ये खुद बता रहे हैं. आई एम नॉट टोल्ड यू एनीथिंग. एक्चुअली मोस्ट ऑफ आवर पेशेंट्स हियर, यू वुड हैव सीन आवर अर्लियर वीडियोस, डोंट लाइक टू टॉक. दे लाइक टू शाई अवे. They don't want to say anything. But lot of my patients, trust me, 95% से ज़्यादा ही हैं,
who call and tell me, doctor, I'm like so good, I'm very happy, this and that. I tell them, Arey, why don't you do something on a video? No doctor, any dijiye, just between you and me, or this is only for us. So I'm happy you're speaking out.
Sharing is like, when people share about its opinion, thoughts, surgery right now, so another people will understand who's planning, future.
Correct.
Planning kar raha hai. So you will get a good idea ki how's premises, how's doctor, how's patient come,
Correct.
तो ये सब अफेक्ट होता है, तो आगे जाके वो थोड़ा डरना कम कर देगा. That is my concern.
Yeah, no, definitely. Thanks a lot.
हम आराम से even no issue man, किसी चीज का.
और आप अकेले भी आए?
मैं अकेला है.
हाँ. So
I did not tell my family. Nobody is informed.
No, we are not advising that you do that, but अकेला भी आ सकते हैं आप अगर if you want to do that, we will be able to help you.
Nurses are there who gonna take care. Sisters are there. Sir is there. They all are easily available man. Just knock करो आ जाएंगे, help करेंगे. Whatever you need. So no need to worry about it. Chill. Come आराम से आओ, relax करके आओ. Have a good, get a handsome face, beard or transplant, whatever you want. Go आराम से man. This is a life. अभी नहीं जिया फिर कभी नहीं जिया.
अरे यार सच बता रहे आप.
चाहिए. I was in lacking. तो मेरे को चाहिए तो मैं ले लिया.
अरे नहीं, आप तो बहुत कॉन्फिडेंट थे पहले ही. मतलब you were a very positive person from beginning.
सर की तरह वेट चाहिए अभी.
अरे ये तो है. मेरा आर्टिफिशियल नहीं है. नहीं बट लगा देंगे आपको भी.
मेरे को एक्चुअली किसी को स्किन बर्न हुआ था चेन्नई में. आई वाज इन चेन्नई. आई डिड ये स्टडी फ्रॉम चेन्नई.
अच्छा ठीक है.
स्किन बर्न हो गया तो उनको दाढ़ी उड़ी आना. मैं केमिकल लेजर किया था. देन वो एच ग्लो हो गया. फिर सनस्क्रीन वो सब पे था. मैं फिर बंद कर दिया.
दैट ऑल अफेक्ट्स द हेयर ग्रोथ.
तो स्किन खराब हो गई. स्किन नॉर्मल था. इट वाज लाइक दिस वे. स्किन ऐसा था.
नहीं अभी भी इट्स नॉट बैड. But this hair growth thing we can address 6 months later or something. We can easily address. A little bit more we'll wait. Better because blood supply has to come right for the skin, and now we've dissected inside everywhere. So wait a little bit longer. It's better.
People, you can remove your plates also after 3 months to 6 months. This is permanent surgery. It is not necessary कि plate डाल दिया तो अंदर ही रहेगा. नहीं, you can remove. मैंने फिल्म स्टार हुआ I think so.
Yeah.
सर्जरी करते हैं then they remove. कि बहुत लोगों को पसंद नहीं प्लेट रहे. They travel through flight तो पकड़ा जाता है. तो what is there?
Most of the time these plates and screws are not getting detected now because of the quality we use, and also they know that these kind of surgeries are being done now. In the Western world, more of it gets done. Various implants on the face is it's a rampant thing because facial beauty, facial aesthetics is like so much in vogue right now. After all the Instagram and the selfies and everything, so they know. मतलब 10-15 साल पहले when I started off, तब ज़्यादा questions होते थे airport में कि अभी. Then initially there was some this terrorist thing and all हो रहा था some years back. That time also a few patients had some issues. They used to ask us, but आजकल कुछ नहीं हो रहा ज़्यादातर. नहीं हो रहा है.
Maybe people are aware about.
More and more people are aware. वो भी सही है.
कोई चुरा के भी लेके जाएगा नहीं.
वो तो बोल नहीं सकते.
डायमंड भी डालना मतलब dead. बंदी की डेथ हो जाएगी.
नहीं कर सकते लोग कुछ भी पैसे के लिए. ऐसी बात नहीं है. बट I mean they can detect it with the scans, and probably they have much better equipments to scan everything through and through. So it's by I think now it's.
So finally I'm happy with my result.
Thanks a lot man.
और लगेगा happiness then again I'll come and do it. और करेंगे.
अरे we'll do beard. You will be happy with that. I'm telling you.
Beard I'm looking for fully.
हाँ that will do. हो जाएगा.
ऐसा दाढ़ी निकालेगा एकदम बड़ा फेस रहेगा.
पक्का. All right. Thanks a lot.
Thank you so much.
And I hope that was useful for a lot of our subscribers also. I'm definitely sure it will be useful.
If it's like even if you're planning for a surgery तो pre-consultation ले लिया करो अगर हो सके तो through video call.
Yeah, a lot of people are doing that.
Best. तो एक बार सर देख के तुमको ना एक
आइडिया तो मिल जाएगा.
बता देंगे. और otherwise if you want to come you can come down relaxed. केरला अच्छा जगह है. It's not very bad. Okay, you come for 2 to 3 days, see the hospital, see the premises, talk to doctor. You feel like I'm so sorry जाना चाहिए तो next day you tell doctor, they will arrange.
Yeah,
they will make a plan according to the your availability and they'll start with the surgery. Maybe within a month or within a week, within 2 to 3 days. Okay, you can do that. No need to be shy. डरबो यार.
ठीक है. धन्यवाद.
एक ही लाइफ में.
Thank you. Bye.
Thank you so much.
Welcome.